Hi, this is Vaishnavi, and I'm going to talk about prediction of progression in MGUS using transformer-based time series modeling. So, MGUS is a pre-malignant condition for smoldering multiple myeloma and other malignancies of hematology. And so, using the baseline risk is not the only option. So, we try to use the serial labs from diagnosis. So, we use the STRATS model for modeling that, and so for that we use 3 years observation window, and from that observation window we predicted the progression risk up to 5 to 10 years. So for that we use key labs like CBCs, free light chains, and M-spike creatine and calcium. The model uses like proxy self-supervision and fine tuning with the time to progression data to predict the risk. So the input is labs, mask and time, and the output is risk for each patient. So for that we got the concordance index of 0.75 as compared to the baseline Cox proportional hazard model based on the Mayo risk stratification criteria, and the baseline risk is 0.54. So it represents the difference of 0.20% from the baseline model. And also we did the risk stratification of risk into low, high and intermediate, and again the STRATS model shows good results from the baseline model. Thank you.
Thank you for going over this nice work. And you see that your future work also includes some external validation. So is there any specific data sets or any specific study that you have in mind where you want to apply this external validation work?
The main question here is like identifying the high risk patient in the MGUS group. So we are looking for some like test cohort to do validation for our model, then we can use in the clinical settings.
So in the identifying the high risk group, do you think this is feasible if you are considering a clinical trial, and when the patient group enters the clinical trial, is it possible to determine which patient group was high risk based on the criteria that you have set for this model?
Yeah, so there is not 100% chance we can identify the patient is at high risk, but we can definitely help clinicians to like identify who is gonna progress in the high risk. So we are just identifying the probabilities of the patients who are gonna progress. So
that is a great addition, because that would also help clinicians to monitor those patients separately, so that they can follow up their progression and take good care when they are progressing. So yeah, thank you for your nice work. Good job.